All right. Well, thanks to all of you for joining our first installment of our PacVec seminar series for the fall. Jenny, if you can keep an eye on the waiting room if people join and just let them in, that would be perfect. And I want to start off by thanking Jenny for all of her organizational efforts to get our speaker lineup set, which is now in place for the next 3 sessions. And with that, Grace, I believe you have to leave us around the middle of the hour, so we'll just jump right in. I just wanted to introduce Grace Oram, who's a second-year master's student in Andrea Sway's lab at San Francisco State University, and she is investigating target and non-target impacts of reservoir-targeted pesticide treatments. And with that, I'll turn it over to you, Grace.
Thanks for that introduction. I'll go ahead and share my screen. Alrighty. Can everyone see okay?
Yes, looks perfect.
All right. As Dr. Barker said, my name is Grace Oram. I'm a second-year master's student in the Sway lab at San Francisco State University, and I'm looking at the direct and indirect impacts of reservoir-targeted pesticide treatment. Our lab is looking at ways to mitigate Lyme disease. Lyme disease is the most prevalent vector-borne disease in the United States, with an estimated nearly 500,000 annual cases. Lyme disease is spread by ticks in the Ixodes genus in North America and is caused by the spirochete bacteria Borrelia burgdorferi. If left untreated, Lyme disease can cause chronic problems with your joints, with your heart, and even with your central nervous system. Our project's goal is to target this source of infection, reservoir species that infect ticks with Lyme disease. Ticks have a complex life cycle that is multiple years. Our target species, the Ixodes pacificus, has a 3-year life cycle. Ticks are born without Lyme disease, and so pick it up by feeding on an infected blood meal host. The first life stage that these ticks have is larvae. They go ahead and feed from a blood meal host, molt, and turn into nymphs. The nymphs take another blood meal and turn into adults. As I previously said, ticks pick up these infections by feeding on an infected animal, namely a reservoir species that are the host organisms for these vectors. Because nymphs are the first life stage that can infect people and are quite small, so people frequently miss them on tick checks, nymphs infect the majority of people with Lyme disease, and as a result are the target of most Lyme disease interventions. Our project seeks to prevent these infected nymphs by targeting these ticks parasitizing the reservoir hosts. Our project took place in California, and in California, there are a variety of blood meal hosts in the complex Lyme disease ecosystem. Starting out here on the left, we have western fence lizards. Western fence lizards infect the majority of juvenile ticks in California, around 90%. So they're really important for keeping a high density of ticks in the environment. However, these lizards do not spread Lyme disease and even have a borreliocidal protein in their blood that clears the infection from any infected tick that feeds on them. So in some ways, they are beneficial to public health. In some ways, they are detrimental because they keep a high number of ticks in the environment. Now moving on to our reservoirs, the animals that can infect ticks with Lyme disease, we have species like Peromyscus mice and also dusky-footed wood rats and western gray squirrels. We tend to consider western gray squirrels and dusky-footed wood rats to be more competent in that they infect a higher number of ticks that parasitize them and tend to have higher tick burdens. So we are looking at deploying reservoir-targeted pesticides, basically pesticide-lined rodent bait stations to prevent these reservoir species from being parasitized by ticks. There is a large body of research into these treatment methods on the East Coast, which have found mixed results. And there are a couple studies looking into this treatment in California. One study, Lane et al., found that permethrin treatment decreased tick burdens on dusky-footed wood rats. However, this study did not look at any longitudinal impact of treatment or how this treatment would impact the density of ticks in the environment. So overall, as you can see through the simple schematic, the rodent is going to treat itself for ticks, is going to be attracted by the tube by the bait we place, is going to walk through and is going to be coated with pesticide and hopefully decrease the number of nasty ticks on the animal. So we are looking at the following research questions. We are interested in how reservoir-targeted treatments impact reservoir tick burdens, so the number of ticks on these mammals, the density of nymphs in the environment, and also nymphal infection prevalence, the percentage of ticks that are infected with Lyme disease. We believe that reservoir-targeted treatments will reduce mammal tick burdens, decrease the density of questing nymphs, and decrease the percentage of ticks infected with Lyme disease. We are also interested in the indirect impacts of this treatment, namely how this treatment will impact tick burdens on Western fence lizards, since they're such an important part of the Lyme disease ecosystem. This information can also help us better understand the pesticide's mechanism. This treatment has been shown to reduce tick burdens, but we're not really sure how this is happening. If it's happening through a contact irritancy effect, if these pesticide-covered rodents are simply deterring the ticks from parasitizing them, or there is a mortality event. If the pesticide is simply deterring the ticks from parasitizing the mammals, there may be a host switching event where the ticks will switch from mammals to the Western fence lizards. And we would see an increased tick burdens on the Western fence lizards if this is the case. If there's no host switching, we would expect to see no change in the lizard tick burdens or even a decrease. So looking at the indirect impacts helps us better understand the Lyme disease ecosystem and even the mechanism of the pesticide. For this study, we selected 3 sites in the San Francisco Bay Area, 1 in Marin County and 2 in San Mateo. Each one of our sites had 2 paired plots, 1 control and then 1 pesticide where we placed the rodent-targeted bait stations. We used 2 pesticide types in this treatment, permethrin and deltamethrin. Both are acaricides, which is just a specific word for a pesticide that targets ticks and mites. We used 2 different mechanisms of applying these pesticides, one in a permethrin-soaked cotton that we glued to the inside of the tubes, and one with a dust, in the case of deltamethrin. These are the most commercially available applications that we were able to purchase. We applied these reservoir-targeted treatments over 3 years, 2023 to 2025, during peak juvenile tick season. In addition, we also conducted mammal trapping at each one of our sites to get an idea of the density of reservoirs at each site. For each mammal we captured, we also collected the number of ticks off of each animal. We also conducted tick dragging, which is the standard method for getting the density of questing nymphs in the environment. Each one of these ticks that we collected, we took back to the lab and tested for Lyme disease. And we also did a thorough analysis of how many lizards were on each plot. And in each lizard, we calculated the number of ticks on each animal. All right, moving now on to results. When we were looking at mammal tick burdens, we found a significant decrease in the number of ticks on our reservoir species for all 3 of our years. This graph shows the mean Ixodes pacificus larval tick burden, so the larval stage of our target vector species. And we can see here that our control plots in the pink had a much higher mean Ixodes pacificus tick burden compared to the acaricide or pesticide plot. And this effect was consistent across both pesticide types and, as you can see here, across all years. All right, now looking at density of nymphs, a metric for the overall tick population. In 2024, we found that the acaricide led to a decrease in the density of questing nymphs, a metric for the density of nymphs out in the environment searching for a blood meal. We broke these data down by pesticide type. This figure shows the total number of nymphs in each one of our plots at our 3 sites. So each of these figures show the 2 paired plots. When we're looking at our 1 permethrin plot in San Mateo, we can see a big difference in the total number of ticks collected in our control plot on the left and the pesticide on the right. And looking at our deltamethrin plots in San Mateo, we can see that there is a reasonable difference between the total number of nymphs in the control plot versus the pesticide plot at our Edgewood site. And looking at Phylloli, we can see that there is a small decrease in the total number of nymphs in our pesticide plot, but overall we're finding pretty similar densities between the control and pesticide plot. In 2025, our preliminary model did not show a significant decrease in the density of questing nymphs. And we're also seeing an interesting story when we break these data down. We decided to switch the pesticide used at Edgewood from deltamethrin to permethrin to better understand and break apart the effect of county and pesticide to see if some of the results we're having were an impact of the ecology of the county or the pesticide itself. For permethrin, our two sites here, San Pedro and Edgewood, in our paired pesticide site, we can see that there is a decrease in the density of questing nymphs in both of our plots. And something in the opposite direction happened when looking at our deltamethrin plot. We actually found a higher number of total nymphs in our pesticide plot compared to our control. And obviously this is the opposite of what we want to occur for any public health intervention project. All right, now looking at nymphal infection prevalence, the percentage of infected ticks. In 2024, our model did not find a significant decrease in nymphal infection prevalence. We are still working on analyzing all of our data for 2025, so we are looking forward to see these results. When looking at infection prevalence, we're also seeing different performances when we break down the two pesticides used. When looking at permethrin, we can see that there is a net zero risk of an infected tick in the control plot and a much higher risk of infected tick in the control plot. And when we look at deltamethrin, we can see another negative result. We can see that there is a much higher risk of an infected tick in the pesticide plot compared to the control. So once again, deltamethrin is performing in the opposite way of what we would like. All right, now switching from our direct effects to our indirect effects, we found once again that the two pesticides are behaving differently. Compared to our control plots, we found that lizards had a fewer number of ticks on them in our permethrin plot, indicating that the ticks are not switching hosts. We can see here that deltamethrin performed quite similarly to the control plot, indicating once again a difference in the two pesticides. All right, now looking at our conclusions, we found that a decrease in tick burdens did not correspond with a decreasing infection prevalence. This may be a result as the ticks switching to a reservoir host that was not targeted by our treatment or something similar happening. These results are quite similar to studies on the East Coast that found a decrease in reservoir tick burdens, but no change in the human risk of disease or other metrics of Lyme disease risk. Alrighty. So interestingly enough, we found that the two pesticides used performed quite differently. And as I mentioned earlier, we applied them in slightly different ways. For permethrin, we took these commercially available permethrin soaked cotton in these cardboard tubes. And then for deltamethrin, we applied a dust to the interior part of the rodent bait station. Interestingly enough, our reservoir species have a behavior of taking fluff and other soft materials in the environment and taking it back to their nests. And we believe that these animals taking the cotton may lead to a longer treatment period and may lead to the results that we are showing. Because if the pesticide is in the environment for longer than the established tick season, that could lead to a decrease in ticks in our density metrics. All right, now looking at our indirect results, we are seeing that mammal treatment is linked to lizard tick burdens. And if you treat one aspect of the Lyme disease ecosystem, it can have an impact on the other aspects. Once again, we're seeing that permethrin is more effective than deltamethrin. And our results suggest that the ticks are not switching between mammals and lizards, and there's not just a contact irritancy effect happening. Alrighty, future directions for this project. We're going to continue to investigate the mechanistic reasons for permethrin's stronger effect. We'd like to look into what species are actually removing the cotton. Anecdotally, around 80% of the cotton was removed from our bait stations every time I went out. And I'd like to set up some cameras to better understand what species are engaging in this behavior, so we can offer recommendations for public health agencies and better understand how this treatment is working. We're going to continue our infection prevalence work through 2026. We're going to go out next tick season, collect the density of nymphs, and also analyze those ticks for Lyme disease to better understand the impacts of the previous year's treatment. All in all, this work is going to help us develop recommendations for public health agencies and work to protect people and animals in the outdoors. Special thanks to the previous grad student on this project, Maxwell Newton, my mentor, Andrea Sway, and my field tech, Evan Burnett. Evan just got into grad school, so big congrats to him. Thanks also to PacVec for funding this research, as well as our collaborators who, without them, it would not be possible to get this project done. And finally, special thanks to all the SWAY Lab students who are working diligently to process all these data. Alrighty. Thank you guys for listening. Does anyone have any questions?
It's a great presentation, Grace. I'll open it up now to the audience. Does anyone want to either unmute yourself or feel free to type questions in the chat if you find that more convenient? I just want to mention also that if I understood Dr. Sway correctly recently, I believe you'll be presenting next week at the Entomological Society of America conference. Is that correct?
A 10-minute version of this presentation, but
okay. So for those going to the ESA meeting, make sure you take the chance to meet Grace at the meeting.
yes, be great.
I see a question from Jessica Coolidge saying, how long did it take to deplete the deltamethrin dust from the tubes? Did any tubes run out of the dust?
Yeah, as far as we know, the tubes were not running out of deltamethrin. We would go ahead and reapply the deltamethrin every 2 weeks, and when I came back, there would still be dust in the tubes. For the permethrin, the cotton would be removed within a couple days. I don't have exact data, but just from going out and returning to the field sites, it was gone pretty quickly. Did that answer the question?
Yes, thank you. All right, and Jennifer Henke wants to know, she said, I missed the first part. First, she said, great results, Grace. And then she said, I missed the first part. Are there other active ingredients that you can examine besides deltamethrin and permethrin?
Yeah, I haven't looked into that. I believe it's mostly filler for both the products we used. I think that would be a great next step to the project, though.
I was curious too, if you can think of any plausible mechanism by which deltamethrin would cause increases in density or increases in infection prevalence.
Yeah, I think it probably comes down to host switching, that maybe there is a reservoir that we don't understand yet. It could be possible that they're switching to a reservoir we do know, the Western gray squirrel. We treated them by putting out 2 squirrel feeders that are aligned with pesticide at each plot. And I'm wondering if that was not sufficient. So I think in that case, it's possible that they're switching to a more competent reservoir. I think unfortunately it's a black box and we don't understand. And honestly, I need to sit with these data and work through it myself. So, yeah, really great question. Thank you.
Okay, and Mansour Hussein asks, what metrics were used to quantify tick reduction, tick burdens on hosts, or questing tick density?
Yeah, so we looked at tick burdens on hosts and questing tick density. Yeah, and we found significant decreases for both pesticides all 3 years, but then we only found a significant decrease in tick burdens in 2024, but not 2025. So I think maybe there's an interannual effect that's leading to the inconsistent results. Great question.
I was also curious about the point you made about a longer treatment period and the rodents taking the cotton to the nests. Do you think that has any potential to increase resistance by maintaining a longer, maybe sublethal exposure in the ticks?
Yeah, that's a great question. I don't think we're seeing any evidence of that right now. And I don't think studies from the East Coast that have been looking at that treatment longer have seen that, but I think that is a potential problem. And also, I believe my understanding of this pesticide is that it kills ticks pretty quickly, so I wouldn't think there'd be a sublethal effect, but yeah, that'd be a very interesting research direction.
All right, well, I'm seeing the chat is going quiet for the moment, so thank you so much for your time, Grace. And I know your time's tight today in general, so really appreciate your joining us and look forward to seeing you at ESA for those attending the meeting.
To see everyone there. Thank you so much.
All right, and next up we have Dr. Paula Stigler Granados, who's an associate professor and division head of environmental health at San Diego State University. And she has joined the PacVec Center to do social and behavioral research on vector-borne diseases in our region. She's a subject matter expert and leading researcher on Chagas disease with over a decade of experience in vector-borne disease and environmental health. So with that, I will welcome you, Paula, and turn it over to you when you're ready. It's great to have you.
All right. Hi, everyone. We're going to kind of shift the gears and come over to a little bit of, as Chris was saying, some mixed methodology, public health data that we've been working on. And I see several of my colleagues here from San Diego County Vector Control. So hopefully if there's questions, they can also help chime in on this. But nice to be here. This is a little bit of a different topic for me. I usually do Chagas disease, but happy to be talking about this. And some of you may have seen some of this data presented by a couple of our students if you were at the PacVec meeting last year, but if this is new, hopefully it's interesting. So we are looking at assessing programs and public perceptions for prevention of mosquitoes in San Diego County in particular. And I've had the honor and pleasure of working with our local vector control agency on trying to understand how to get into these hard to reach communities in terms of understanding their practices and beliefs. And it's been really interesting. I think we still have a lot more work to do. But so far, this is where we're at. We had last year one of our first locally acquired dengue cases. And so something that we really work hard on here in public health is obviously educating people about the importance of vector control. But our San Diego County Vector Control Agency does an awesome job with creating educational materials and providing services to our county members. The problem is that not everybody knows about them or accesses them. And we also have some different types of beliefs based on like different cultural identities. And just, it's been really interesting trying to figure out what people know, what they don't know, where they're accessing their information from. And we found some pretty interesting concerns and thoughts to move forward with this next phase of doing better outreach. And so again, our job from an academic institution is to partner with our colleagues to try to figure out how do we do this better. And so you can see here, here's a map of San Diego County up here on the screen. And we are a massive county down here with a lot of small communities and pockets separated by obviously the coast, but we also have mountains and canyons. So we have a pretty interesting collection of groups and people living here in our county. And if you can see the highlighted blue area, these were counties that, I'm sorry, parts of our county, zip codes within our county that the Vector Control Agency deemed that were a little bit hard to reach in terms of accessing services. So a lot of the people in these communities are lower income, communities of color, mostly Latino communities, but also some Filipino communities, migrant farm worker communities, et cetera. And a lot of these are not, communities are not accessing any of the vector control services. And so this is where we were trying to target a lot of our understanding of how to do better outreach there. So to be able to do this, we started a program, we call it Vector Wise, with the wise being in a second word, like understanding, about vectors. And we did an assessment, and specifically we were looking at just understanding where the gaps are in the outreach efforts. And so you can see our students here on the screen. Dana and Austin did a lot of the outreach work, also with my colleague, Dr. Lloyd. And you have our amazing vector control people here on the right they're out there at all these events all the time. And so it's been great that we just were able to put the survey out there. And I'm going to give you, here we go. Here's the research question that we had posed for this. And it's, how do cultural, economic, and social factors influence how people are engaging in prevention practices within our local county programs, but especially in those underserved communities, like I mentioned, and how we can get better at community engagements if we understand that a little bit better. So we disseminated a pretty short survey. We have paper versions and we also had tablet versions. And mostly people could just scan a QR code. We had it in English and in Spanish. And we're just basically evaluating the public knowledge, awareness, attitudes, and practices. We call it CAP for short. And this was all around mosquito control programs. And so we did the survey, and then also Dana, our just recently graduated master's student, did the key informant interviews with local community leaders, just to kind of understand what their perceptions were. And I'm going to show you some of these results. But before I do that, let me explain a little bit more about what each of these things are. And I don't know how many of you are in public health. We do this a lot for understanding knowledge. And basically, these are our variables. So a knowledge assessment looks at how much people know about mosquito-borne diseases, and this is done through self-ratings and disease identification. So basically ask them a series of questions, and they know that these are caused by mosquitoes or not. Awareness reflects exposure to information. So have they seen anything about prevention and control services specifically related to the county vector control program? Attitudes is how important they believe prevention is and their level of concern about mosquitoes. And the practices really just measures the actions they take to protect themselves and their communities. So if you put all these constructs together, you get a pretty comprehensive view of the public engagement in mosquito disease prevention programs. And so what we found out was, actually, I'm still going to go through the methods. I apologize. I'll go through the methods first. I'm already trying to skip to the results because I like that part the best. So the quantitative part was the cross-sectional survey, so done point in time. We have new data. This was originally presented, PowerPoint was put together, and we had 216 responses, but now we have 301, still presenting very similar data results, even with those additional 80 or so results. Again, this was all of San Diego County. I talked about the measures and then how we recruited people. The qualitative was semi-structured interviews. I accompanied Dana on a lot of these, going to talk with mayors of the specific cities that we have, also with some of the community leaders. Almost everything that we did for the qualitative was done in underserved areas, so areas that the county had identified as having few service calls and also being underrepresented in terms of economics and socioeconomic status. And then this was also the measures that we use for qualitative were the CAP as well as perceived public opinion of our local county vector control services. And we recruited through just personal networks and just reaching out and emailing people. All right, so a little bit about the quantitative results that we found. So we had this composite score for knowledge, awareness, attitudes, and practices. And we basically found that all four are moderately and positively correlated to one another, mostly noting that awareness was more strongly linked to practice than general knowledge. And that suggests that direct engagement with vector control programs could drive preventative behaviors compared to just knowledge alone. So basically understanding that when they did access services, they gained even more knowledge and put things into practice. And in terms of our geographic analysis across we've divided it up into 6 regions. We found that knowledge is highest in our north central region. This is an area which is like a lot of major universities like us, SDSU, UCSD, and that the knowledge was lower in the east and south, where we do have a lot of our priority zip codes that I mentioned, that where they're located. The attitudes were mostly positive in the south, and lowest in the north. So both of these areas have priority zip codes, while our practices was really the highest in central downtown and our lowest in the east. And so kind of all of these things, they're just like, I guess we call them geographic factors, but they're actually like proxy for issues like socioeconomic status, language barriers, local service availability that cluster in certain regions. And so this is sort of helping us to target our tailoring of our public health strategies. And so overall, you can see that with our priority zip codes, lower knowledge and practices, but slightly more positive attitudes. So this is what our regions look like. These are the 6 different regions that I just discussed. And again, like I showed you on the first slide, these are where our priority zip codes are. So you can kind of see how we were referring to those. I have a couple of graphs here in a little bit that I can show you to give you a little bit more visualization of the results that I just presented here. And so I want to put this together with our qualitative next. With the qualitative, we had 4 major themes, and I don't know if any of you do qualitative research, but you basically put all the communication into, we used in vivo software, but also just visualizing what people say. And we came up with 4 major themes and just noted that there was a general lack of awareness. So many people, like including community leaders, they just didn't know about the county's vector control services. And so there's a real concern for diseases like dengue, which they knew about. It doesn't always translate into action, as we can see through these results. The second theme that we came up with was trust and cultural relevance, and noting that those were critical. There was a lot of fear around things like chemical spraying and use of DEET, or a lot of people noted that they feel uninformed and concerned about their safety. And so really noting that you can increase that trust when you can share it with our like community health workers or trusted messengers. And that was noted in a lot of those conversations. Third, we also heard about structural barriers and logistical barriers. And so at outreach events, they said that they often happen during work hours. Email blasts don't always get read. Clinics don't always have the resources to distribute information on their own. And so there was a lot of discussions about how people are not able to get the information that they feel like would benefit them, and how to get it to them in a better way. And then also there was a lot of practical ideas about like more targeted outreach for our Spanish-speaking community or our Tagalog-speaking community, outreach at churches, schools, even using like different types of visuals and storytelling to make messages more memorable. And so I think that there was discussion about the county vector control collaborating with our local clinics and community health workers as well. So there was some really good ideas thrown around in these conversations about how to do better outreach in these difficult to reach communities. And so from this, so far, what we've come up with the data that we have right now for recommendations is prioritizing awareness in the outreach activities, like awareness of services that are being able to be provided. Improving accessibility and cultural relevance. And I think that's something that right now we're talking with the county vector control team about how do we do that, and communicating with our community leaders about best ways and best practices for that. Have these tailored strategies ready for our priority zip codes, And then obviously, as was stated by some of the interviews that we had, is leveraging some of the work that we already have with our local clinics and community health workers through our partnerships with our local health department and others. I think we have some good ideas for recommendations. And so next steps, now that we have some of this information, is to move forward with in putting some of these things into practice. And so some of the strengths and limitations, I think having this mixed method design so far gives us a lot more valuable insights than just a short 10-question survey. However, we have to show that there was underrepresentation of certain groups in the sampling methods just because of the nature of it was difficult to get to these communities anyway. We did have some really nice postcards with graphics and a QR code that people could scan with their smartphone that a lot of people took at different various events like farmers markets. And I know they went to like story time at the library. A couple of our students just stood out in the parks in some of these higher priority areas and just handed out postcards and talked to people. So sort of like just, I don't know what they call that, like snowball sampling in the parks. And so we did a lot of that, but it also just didn't get everybody clearly. I wanted to share with you just a little bit of the supplemental information, and these are kind of busy, so I have some graphs to show you here in a second, but just so you get a little bit more of an understanding, this hasn't, percentages of these numbers haven't changed much, even with the additional 80 or so surveys that I mentioned, but the majority of the respondents were female. So, and this is of the cross-sectional survey. So you can see 53% of them. Also, the majority of our respondents were between the ages of 25 and 44. So a pretty good, range of younger and older, but most of it was in that middle range. As far as our ethnicities go, you can see that here we had about 47% of our respondents were white. Also, we had Latino population was about 16%. This is a bit complicated too. I think that some of the Hispanic was also mixed in with the white. So we're still kind of picking through that data just a little bit. And then from our regions, you can see we have just kind of a variety, but the bulk of it, the responses that we got were from our North Central region. And again, our priority communities that we were trying to reach out to, only 17% compared to 83%. So that's really important to note. And I do believe in these last 80, these are the numbers that might switch up a little bit, was we did get more priority this time with those final results. And so once we have those, I'll be happy to share that with the group. This is a very busy survey, and I'm going to show you a better graph here in a second. But basically, if you wanted to look at it from a regional perspective, you could see what some of the scores were in terms of knowledge, awareness, attitudes, and practices. And I will show you here. And again, you can see the ends in these. The majority of them came from that North Central. A lot of our targeted areas are going to be in the South and the East, and some in the Central. But here's busy but yet better graph, I think, of showing where you can see at the bottom you have your geographical location, and you can kind of see just visually where you have higher knowledge versus awareness versus attitudes versus practices. But I think overall it's interesting just to show that you kind of have similarities in terms of knowledge being the highest and awareness being the lowest about services. Again, attitudes are pretty high, but then practices are sort of moderate in the middle in terms of what people are actually doing. So clearly not a whole lot of knowledge about services that the vector control agencies can add to this, but that's again what we're working on. And then this is priority versus non-priority. So if I wanted to break it down in just the two categories of the same knowledge, awareness, attitudes, and practices, again, noting that there's a whole lot more non-priority zip code responses than priority, but still you can see what these numbers look like. And here I have it in a better chart here where you can see that the non-priority communities are in blue. And again, this is a percentage. So you can kind of see how priority versus non-priority are, that the knowledge was a little bit less, but attitudes were better. So it's basically telling us that there's people that are identifying with this idea that they would like to have more services and they'd like to be able to put more things into practice. They have a better attitude about it. But yet that awareness is still low and the practice is moderately low as well. So I'd definitely like to thank our two students. They're both master's students, Austin and Dana, who helped put all this together. There's a publication coming out very, very soon. We're almost done with it. Dr. Linda Lloyd, who's my partner, and obviously our San Diego County Vector Control team, who are amazing. We have Nikos Garfield, Allison Bray, and Gerald Tonecap with us. I think they might even be on. And if they are, they could probably help answer some questions. But this has been really great experience for us working with them. And I think, again, next steps, we're starting to look at how we can map out some of these responses and look at targeted cultural and behavioral practices that we can do better outreach in these communities. And that's what we're working on right now. So questions?
All right, thanks, Paula. Great presentation. And we already have one question in the chat from Chelsea Gridley Smith, who asks, do you have any plans to use these findings as a baseline to monitor for improvements in one or more of the areas over time?
That is a great question and something we've been talking with our vector control team about. And I think that a lot of what they're already collecting really good data on is obviously numbers of mosquitoes that they're trapping in these priority areas, which they do have traps out there. And again, Nikos or Allison, if you're on, please feel free to chime in. But also looking at how many service calls are going out to these communities. And so the county already has this data. So I think that that's our next step, is to, again, map that onto some of the results that we have as the baseline and do see if those numbers change over time. And I don't know if, Nikos, if you want to chime in on that.
Hi, Paula. Hi, everybody. The data is like super interesting because as a lot of vector control agencies will probably feel this as well. When we had, especially when we had Aedes aegypti come into California and start expanding, the real focus of our outreach was, hey, just get rid of the standing water in your homes. You don't need to call us to do it. Just do it yourselves. And so our outreach was focused on the messaging, the knowledge, the awareness, but not necessarily the awareness of our program, because we couldn't handle everybody calling, 3.3 million people down here calling us for Aedes. So I'm reflecting on your data that shows, the knowledge up there, but maybe not the awareness of our program, as we are the ones who are getting that message out to do that. As Aedes and mosquito issues have evolved since, we've kind of gone back and started thinking, okay, maybe we should shift a little and get our name and us out there as a resource should people have issues that are a little more complex to deal with. But yeah, it was really neat seeing this data, and maybe there's a partial explanation for the disparity between those measures.
Yeah, and I think adding to that, there's some pieces of the data that I've seen that's hasn't necessarily made it into this presentation, but how people receive their information. The majority we saw received it through the news and social media. So obviously we kind of know that the news, actual news broadcasts, was the biggest one, which I found interesting. I don't have regular TV, I guess, so I don't really get the news, but I get it through apps on my phone. And so people talked about that. And I think the other piece, sort of tying into, and I kind of want to do a deeper dive on the data on this one too, is that understanding what some of those beliefs are that are not practical, I guess, let's call it that. So a lot of people stating that they still, hang those plastic Ziploc bags full of water in front of their house, or they do certain practices that are not necessarily based in evidence of how they work or don't work, as opposed to the evidence-based, emptying your standing water or doing these sorts of things like that. And so we're sort of seeing that there's these different cultural beliefs that are out there that are not necessarily bad practices, and we don't want to tell people to stop unless there are bad practices, but they don't necessarily line up with what we know to be effective practices. And so like natural repellents and incense and things like that were a lot of the things that we saw. So we're still kind of digging in to the data. We can ask it a bazillion different ways, but I'd be interested, like Nikos, like you said, it's how do we make sure that if we're finding that some of these priority communities have non-evidence-based beliefs or practices that aren't effective, how do we shift that by providing them with the correct information, but in a culturally sensitive way? So I think that's always the strategy. It's difficult to do that, but I think going back to the baseline measures is, are people, maybe a better question to ask is, are they, maybe it's not their awareness of the programs, but awareness of, look, again, those evidence-based practices that the county is promoting. That could be something that we look at a little bit deeper.
I know there's some evidence in the literature that people are more willing to pay for reduction of nuisance biting than they are to pay for disease prevention, at least in terms of mosquito control. And I'm sure all of us in this audience have been in some form of a conversation where someone says, "Oh, I hate mosquitoes, kill them all," which is, kind of further evidence that nuisance biting is really what people are aiming to prevent. And I'm curious, did you ask people about how they perceive being bitten, and are they being bitten by large numbers of mosquitoes? And I've always wondered if we could relate that somehow to trapping data for houses that could be paired with that, where it could sort of be adjusted for, so to speak, in the analysis.
It's interesting. I would have to pull up the survey to see, because there's some nuanced questions about biting and things like that. I would have to pull it up and just see what was the specific question. I don't think we did ask specifically about how, what their perceptions about biting are, but I do know that when we asked about different types of diseases, what they use for protection, and there was sort of a question was like, I don't get bit by mosquitoes, under we asked what they used for prevention, like in terms of sprays and things like that. So I could go back and look and see if there was a lot of people that said they don't get bit, which might be interesting too, because again, San Diego was infamously known for not having a whole lot of mosquitoes until, I don't know how long ago, Nikos, you all know better than I do, but now everybody's like, why are we all getting bitten by mosquitoes now, including myself? Things have shifted here quite a bit. So I think that the disbelief that mosquitoes don't exist here is now past us. At least that's what we saw. So I'll take a look at that and see if we ask a question, but that would be interesting.
I see Chelsea Gridley Smith has her hand up. Chelsea, do you want to say something?
Oh, we can't hear you, Chelsea.
We're not hearing you.
Okay, can you hear me now?
Yeah.
Perfect.
Okay, yeah, thank you so much. So I'm with the National Association of County and City Health Officials, and I'm really excited to hear about your presentation, especially the connection of the public health university and the local vector control program there. My main question to follow up and to close probably is around publication, because I'm curious if you're planning to publish your methods and the way you worked with the partnerships and sort of your findings and what you plan to do with some of this moving forward. Because I could see this being a really useful model for other municipalities across the country that are trying to get more information on these spaces, of how these partnerships can be used to collect the information from the community members, partner the universities to actually help do some of that data analysis and the research and the vector program, to really, drill home of like, we can't serve we can't come out every single household and spray, but we do have resources and we do collect data, and we compile them on this dashboard that will help you understand a little bit more about how to protect yourself. So I just think this would be really great information to share. And I was just curious if you had published or plan on publishing this one.
Thanks, Chelsea. Yeah, we actually, this data right here has already been worked up. I think it's sitting on our plates right now just to finalize it and submit it for publication. I know Nikos and his team have already commented, and so Dana is working up this one. And then Austin, this was a requirement of this grant, was that they each do a master's thesis on this. And so their manuscripts are in the works. Austin, I'm meeting with him later today to sort of get him going. He's supposed to be graduating this semester. So those are, obviously, our students have to produce manuscripts. They don't have to be published, but we do push them to publish them. So those are coming out. And I do agree with you. Like, I think the academic public partnerships are amazing. I feel pretty lucky here to have Nikos and his team. We have a good partnership, and we have a lot of crossover with our environmental health division, and they have some of our students there, and then we support this work. So this was a really cool opportunity. Thanks, he put the website there in the chat as well. But yeah, we can put that too in the methods, like how do we develop the partnership? I hadn't even thought about that, but I feel like it's just been sort of a natural fit for us with having a school of public health with an environmental health division that does vector control stuff and research to fit with our vector control program. I will say though, in terms of like the academic piece, we have 4 divisions in our school of public health. So we have like health promotion, environmental health, health administration, and epidemiology. And I had to kind of think hard about how to do this project. And so I reached out to health promotion because I realized that some of our health promotion master's students would have a better grasp at this aspect of a mixed methods qualitative piece, as opposed to our environmental health students that have more of a vector-based education and risk assessment understanding. And so mixing and matching even within the public health programs has been really nice. Next, I'm going to pull somebody from Epi, have our epidemiologists come in and sort of help with understanding a little bit more of the deeper dive on the data. But it's been a really cool partnership. Hopefully Nikos agrees with that. I've had a lot of fun working with them. We're just super busy, but it's been a fun project. And again, next steps are to dive a little deeper on this and get these published and then have more publications. I want to do a geospatial analysis of some of these results, like we were talking about. And I know Allison with the and Joelle there have some good data. So yeah, stay tuned.
All right. Any last questions before we go? All right. Well, thank you again to Paula and Grace for presenting today. Paula, it's been wonderful to have you on our PacVec team, and we're hoping that'll keep going for years to come. So really great work, and we're always excited to have more social and behavioral work within our center, which is kind of a neglected area in a lot of our research. And in that spirit, I just want to remind you all that November 18th, we have another noon seminar, just like today, but 2 weeks from now. And we'll be hearing from Chloe Reyes from Arizona State University, who will be talking about gamified public outreach for mosquito breeding site reduction, which is relevant to the topics today, as well as Laura Bacchus from Cal Poly San Luis Obispo, who will be talking to us about training that they've been developing for undergraduates. So thank you all for attending today, and we'll look forward to seeing you in 2 weeks. Have a good afternoon.